Se kondisyon bou male kanaran, mwen konen fom travese dezer, mem le sable chou bapye, desisyon se pou male.
Hello and welcome to Fonkoze's Voices of Hope webcast, episode 1. I'm Holly Robinson Peete, and I'd like to personally thank you for coming today. You know, the empowering work Fonkoze is doing with the poor and disenfranchised communities all across Haiti is so impactful, and I could not be more thrilled to support their efforts. For more than 2.5 decades, Fonkoze has walked in solidarity with the poor through devastating hurricanes, earthquakes, unrest, and COVID-19 is no different. I hope that once you've watched this Voices of Hope episode that you will be moved to take action. And I want to thank you for being a voice of hope for those who need it the most.
Everyone, thank you so much for being here, and thank you, Holly, for that wonderful introduction. We have an hour that we're going to be sharing with you, and coming up, I want to introduce you to Mary Claire Dorsally, our Chief Administrative Officer at SFF, and my colleague Corinne Ronan, the Executive Director of the Fonkoze Foundation, who will be sharing firsthand their experiences of COVID-19 on the ground. Take it away, ladies.
I'm Mary Claire Dorsally. I'm the Chief Administrative Officer with Fonkoze. I've been working with Fonkoze since 2015. June will make it 5 years since I've been here. So time has gone by pretty quickly. Logistically, we had to minimize our travels around the country. As you know, we all over. We had to travel our travels only to essential missions. When I say essential missions, like if we have to respond to maybe an emergency with the energy equipment or something, or IT has an issue, really essential. And a lot of the logistics we've been doing out to the branches is distribution of preventive PPE, personal protective equipments, hand sanitizers, disinfectant, alcohol, everything that they will need that may not necessarily be available in the areas they're in. So that's what we've been trying to do, the masks, the buckets, and everything else. But logistically, we learned to rely more on technology. Even operation, we're communicating with our branch managers now. We're using Teams and Zoom and having those meetings via virtual meetings. So it's pushing us to be more technology towards the technology, which we know we're on that path, but it's pushing us a little faster towards that, and to be creative in the things we do and how we do them. We've been waiting for the peak to come. It's slowly creeping on us. When I say slowly creeping on us, even though you may see the health numbers coming out that we have 2,000 plus cases today, but we know in reality not everybody's tested. But you hear rumors, so-and-so has a fever, or you hear the symptoms without the person being tested to know that they probably were infected. So what we have done now is we've taken preventive measures. Even prior to the peak arriving, we work in rotation, we space out our staff and so forth, and now we're implementing the rotation among the branches. Meaning if a branch has 4 tellers, we're working with 2, rotate after 14 days with 2, just to minimize the exposure, and also should somebody become infected, we have a backup team to be able to continue our operations. So the impact it's going to have on our staff is that, I hate to say it, everybody probably will know somebody, if not themselves, that gets sick. That's just what the reality is, especially the way people are living, and we live in close proximity. So the possibility of this spreading quickly is very real for us, and it's really spreading real quickly in Port-au-Prince. And so we're trying to find ways to deal with that. As far as our clients, I think in April or in March when we first started, clients were more hesitant and trying to figure out what is going on. When the government issue closed down schools and everything else, the streets were more, you saw less traffic. Everybody was more hesitant in coming out. But by the second month, people were like, either the disease is not real or I can't stay home anymore. So they started to take the streets, which is not going to help with the spread of the virus. With our clients, what we're trying to do is, for our BD clients, send them pamphlets how to protect their business, how to during this time of hardship, what kind of reserves they should have that's for business clients. For Team Action, actually, we're working with the Alpha to develop things. We tell them how personal protection, but now we're trying to develop a pamphlet and telling them what behavior changes should have when they're in the open marketplace. Washing your hands, the exchange of money, and different things. So this is what we're working on to be able to share with our clients. But the economic crisis that we are in, that's coming, I don't know how we can derail that. Like, it cannot be stopped. Right now, the word is already at 110 plus words for US dollars. So it's already high as it is. The inflation is just going up the roof. So we're bracing ourselves for the economic crisis that's coming after this, or that we are moving towards, especially for our clients, because we know it's becoming difficult. It's going to be very difficult. And we're starting to see the signs. I think this is my second major crisis with Fonkoze. The first one was Hurricane Matthew. What I learned during Hurricane Matthew is, I think a day or two, the moment they opened the road, we had an operations team that was already out. By the time I was the administrative director, by the time I was trying to figure out how we're going to get our Okai branch to function, because it was totally flooded, and some of our employees had lost their homes, yet they were at the branch office helping to remove water and do whatever it needed to get the branch operational, because we knew we had to serve those communities. That happened with Okai and Jeremy, Okoto, Bomo. Those were the branches we had during Matthew that was the most impacted. But the employees put aside their own personal prices and were right there ready to get us going. Okay, asking for directives. All right, how are we going to do this? What are we going to do? And I have to say, the commitment and the passion, even from the head operations staff, 2 days on the road. They slept in their cars because some of the places there were no hotels, and some of the food they pack is what they find in some of the places that they went. And even then, when you meet some of my employees who lost everything, when our operational zonal director he gave his clothes that he had packed with him to one of his credit agents who said he lost everything. So to see that kind of commitment and solidarity among our employees during time of crisis, just to make sure that we continue in our mission, is something that has always stayed with me, impacted me. And with COVID, is no difference. And so when the branch director said, okay, this is what I need for credit agents to go out. They need gloves too, not just our tellers, and send a little bottles of hand sanitizers, because we know that we have to keep moving despite of the crisis. Okay, so they're as committed to the mission as any of us can be. And especially, they're the equivalent of our frontline workers for us. They are our frontline workers, our operations team. And you hardly ever hear one of them telling you, I'm not going out. I've yet to hear a director report to HR that I had employees saying they're not going in the field because they fear for their lives, whether it's during unrest, whether during this crisis, or during the flood, or anything. They're always committed, and sometimes it's not necessary for you to brave it out. No, but it's not necessary for you to brave it out. So that kind of commitment to me is what makes the backbone of Fonkoze and has pushed us to the 26 years that we've been here. We're always present in crisis, and our employees know this, and they take this to heart. back in December, we spoke to some of our supporters that have been with Fonkoze since day one, and they're still committed. They asked me questions about the social performance work we're doing and so forth. To those supporters, we say thank you. To the new ones, we say thank you. And the ones that want to come aboard, we welcome you aboard, because we working on the ground. There's a Haitian proverb that says, "Mian pile, chai palou," meaning with many hands, the burden is not heavy. So we welcome all the support. Thank you.
Okay, so my name is Karen Ronan. I work for Fonkoze since November 2009 as an employee, but before that I was actually a member of the Fonkoze Foundation board from 2005 to 2008. So I've been involved with Fonkoze for quite a bit of time since then. My background, I'm originally a medical doctor, born, raised, studied in Antwerp in Belgium. And then when I finished doing my medical degree, I left for Rwanda. And I worked for 6 years in Rwanda, came back to Belgium in '94 and did a master's in public health. And then I came to Haiti, thanks to my darling husband. We actually did our master's in public health together. And when we finished, he said, "Why don't you come and have a look to Haiti?" And 25 years later, I'm still there. So that's my little personal story. On June the 1st, we had 2,507 confirmed cases in Haiti, with 48 deaths. And the daily number of cases is going up. We're at, on June it was 280, yesterday it was 100 and something. So it varies at 200, around the 200 now. We're really in that phase where it's accelerating a lot. For the moment, and honestly, it's the kind of hope that keeps me going. For the moment, it doesn't look like the level of mortality, of lethality is very high. They talk about around 2%, which is way lower than what you had in Italy and France and things like that. And there's all kinds of possible reasons for that, including the fact that we have a younger population, the fact that, you know, we've seen so many bugs come through this country that probably our immunity is a bit boosted also from all these exposures. I don't know. But for the moment, and we really hope, that's the big unknown of this situation, is what kind of level of mortality it's going to have. So the government is trying to set up an infrastructure where you would have like 2 levels of care. The first level of care, which is just IV fluids and oxygen and monitoring by a nurse. And then a second level where you would really have the ICU level more. Okay. But all of that is still very, very unclear about exactly what level 1 and what level 2 would have to be available. You know, being in a leadership position today is a bit of a nightmare, because the trade-offs are huge. And in Haiti, the population is very scared of COVID, and so they react sometimes quite brutally. And so, for example, there's 2 COVID wards, the level 1 wards, that have been burned down by the population, just because people say, we don't want that germ thing close to our homes. Get away with it. You know, so there's still a really, really big problem of stigmatization and of fear that has people reacting sometimes very irrationally. and doing these kind of things. So I know that the government with the committee and a lot of the international donors, a big part of their focus right now is on getting these level 1s and level 2 hospitals and health centers ready. Training, PPEs, oxygen masks, all of that. That's a big priority because it's rather clear that it will be needed. The other big priority of everybody, and Fonkoze has certainly already helped a lot with that, is communication. Is informing people about what COVID is, how they can stop it, and how important it is to not be too discriminating, not be discriminating people who are sick of COVID or people who are going to the hospital. At Fonkoze, from that point of view, we were fortunate because we have this health infrastructure. We have this health team here. We have 33 nurses all over the country, and the nurses work with 800 community health entrepreneurs. In very short time, in a month's time, the central team here had developed a training module in Creole. All the nurses were trained, and then the nurses trained all the Fonkoze staff and all the center chiefs. So over close to 3,000 people got trained in a bit over a month's time to understand what COVID was, what the symptoms were, how you could protect yourself, what you needed to do when you had a symptom, et cetera, et cetera. So I think that it's one of the big strengths of Fonkoze is that we have this kind of network where you can get a message out very quickly. We were able to do that with cholera, and we did it again now. And we're actually preparing to do a second wave of trainings to specifically on how to take care of someone who has a mild COVID-19 disease at home, and also about the discrimination and the stigmatization of sick people. So yes, that's the main focus for now, but what we're very afraid of is the impact of COVID-19 on food security and on the economy at wide. The Fonkoze, the Haiti economy is already a total mess. We had a negative growth last year because of all the social and political trouble. So there's really no reserve at all. And you see a lot of the formal jobs, there's very few formal jobs in this economy, but a lot of them are getting lost. And people are afraid to travel from one place to another. The economy is really low. So once the COVID crisis, like the big wave, is going to be over, we're going to need all the help we can get to get this economy going again and to help people back on their feet as quickly as possible. And we at the foundation, we actually have two ways of doing that. One is by really pushing CLM as much as possible, because the more people we get into the CLM program, the more these ultra vulnerable households will have a comprehensive package of support. But we also want to extend it to the families who are not quite at the poverty level of CLM, but who are still very vulnerable. And we would like to help them through helping them setting up village saving and lending associations while giving them training on financial literacy and giving them a few cash transfers to get them started in their VSLAs. So indeed, in Europe and in China, they had this kind of curve going like that. And when it was going like really whoosh, help, everybody was locked up. And when everybody was locked up, the thing plateaued off. Okay? So the idea is if that you have this, we're starting there now. If you kind of don't lock everybody up, or if you can't, which is probably what's going to happen here, then this thing could go like, okay. So there's projections in Haiti saying that for this first wave of the COVID, the infection, the number, the percentage of people getting infected could go from 35% to 85% of the population. I mean, that's the reality, because it depends on how good people are going to be at protecting themselves and at not spreading that virus as quickly as what it would spread in a natural environment. And it's everybody's guess what's going to happen there. So there's two factors we don't know. Is that is it going to go like that to 35% or to 85%? Nobody really knows. Nobody really knows whether the government isn't going to panic at what time and say everybody stay home, and then are people going to do it or not? Nobody really knows either. And then the last thing we don't know, and that's what I was talking to you about earlier, is we don't know what the level of how serious the disease is going to be. And that's big unknown for everybody. You know, I need to say thank you. But the first reason why I want to say a big, big resounding thank you, though, is for being interested. It's for asking questions. It's for wanting to know what we're doing, how we're doing it, and what it means to live in Haiti and to live as a poor person in Haiti. You know, the fact that they actually care about what happens to us, not just what happens to them and their families and their own lives and their own country, but that they're actually interested enough to look at what happens here in Haiti, even if Haiti has a horrible reputation, and that they ask us questions and try to understand and to help. That's the very first thing I want to thank people for. And then, of course, the second thing is because of their support. You know, there's no way we could do what we're doing without them, without their support and their donations. So for that too, thanks.
Mwen konen fom travese désert, même les sables chauds papier, décision c'est pour m'aller.
I am now going to do some quick housekeeping things. First of all, I want everyone to take a look at the bottom of your screen. You should have an option for Q&A and an option for chat. In the Q&A section, I would like for you to type in questions that you might like to have us ask our panelists, which I'm going to bring on. Corinne and Mary Claire are actually here and joining us for this portion of the program. Hi, Corinne. And
hi, everyone.
And so please, the Q&A screen will be monitored so that we can address questions. However, I want everyone to be cognizant that due to time, we might not be able to get to everyone's questions. And so what we promise to do is that we will follow up with you via email and make sure that your question gets answered if we weren't able to answer it here on this webinar today. Also, in the chat box that you see also as an option at the bottom of the screen, you will find a link where you will be able to make a contribution to the COVID-19 response for Fonkoze if you so choose. I want to let you know that our board is matching today, dollar for dollar, up to $25,000, all the gifts that are received. So if you feel so inclined to make a contribution to our COVID response, please do so on that link. And if you have already made a contribution, thank you so much for giving us part of your resources, especially during this time of so much uncertainty in so many places. We really appreciate it. So I'm going to start with a question for you, Corinne. Thank you so much for all the information that you provided in your presentation. That was great. So can you tell me a little bit and help everyone that's on this call understand a little bit about safety nets in Haiti? If the government of Haiti has any a safety net that they're proposing for folks who might lose their jobs or might lose a business. You know, in America, we had the benefit of having unemployment, or businesses were able to get these loans to get them through this time and be able to pay staff. Can you talk to me a little bit about that in the Haiti context?
Okay, thank you for your question. I think probably the first thing I need to say is that only a minority of Haitians, I think the last number is around 35% of the adults, have a formal registered job. So these people tend to be more amongst the people who are privileged. The vast majority of people in Haiti earn their living on a day-to-day basis on the market, in the street, during their own activities in an informal way. There is no safety net for either of those groups, neither for those who have formal jobs, nor for those who have informal jobs. The government of Haiti just doesn't have the capacity, the financial capacity to do anything like that. But what they have said they wanted to do was to give a small emergency grant to, they said, around 1 million people, a grant of around, I think it's, at that time it was $30. The problem is that there is no registry of all the poor people in Haiti. And the poorest people are actually living mostly in isolated areas, in rural areas, or in the slums in the cities, and so are very difficult to reach. And so the government is actually scrambling to get that money to the people who really need it. Because in some instances, as they don't have a bank account, they don't have a phone, it's actually more expensive to get the money to the person than what the person is actually going to get in their hands. You know, the government is actually setting up a national social protection and social promotion policy. And Fonkoze has been quite active in helping define that policy. But alas, the whole system is not operational yet. We hope it will, as the years go by, get better and better, and actually maybe help us deal with this kind of crisis a bit better in the future.
Thank you, Corinne. It is really important for us to be able to understand that important context, because I think we often forget that there are places in the world that just do not have the resources, the ability to have those types of safety nets, and Haiti is one of those places. And that's why I guess it's really so much more important that Fonkoze is able to continue to provide the services that it does. We had a question from Christy, who joins us, and she said that she thought that that Haiti was basically on shutdown. Mary Claire, I know you're having technical difficulties with your camera, but could you talk a little bit about the shutdown? Is it really a shutdown, and can Haiti actually really ever shut down?
Hi, Mabel. Sorry, my video won't come in. Are we on a shutdown? They shut down the airports. They shut down the schools. They shut down some factories. It's a selective shutdown, I should say. Can they really be on a shutdown? I don't think so. And I think like Karen stated, and I stated in my video, at the beginning of April, it was a slowdown. I wouldn't say a shutdown. It was a slowdown. But by the end of April and the beginning of May, activities have resumed. So the only thing really currently still on a shutdown are the schools or ports in the airport, which should be resuming next week from what we heard. So no, we're not at a shutdown. And I don't know that they can actually achieve a full confinement shutdown like other countries have been able to do.
Okay, so there's been a slowdown, but there is no real shutdown in Haiti for many reasons, including the fact that people continue to work and sell things in the marketplace. Is that correct? And our branches are not shut down.
Correct. I'm sorry, I couldn't hear you. Can you repeat that?
I said, so thank you for sharing that about it's been a slowdown, but not a complete shutdown, because our branches also continue to operate. Is that correct?
Of course. After the government decisions in March, a lot of the banks and other financial institutions had decided to reduce their hours and also not to function on Saturdays. As you know, with the population we serve, there are certain things we cannot afford to be able to do. So therefore, we kept our regular working hours, full days on the weekdays. And on Saturdays, we're still functioning a half a day like we usually do. Recently, we had a meeting thinking about maybe taking at least one Saturday a month and shutting down to allow staff to do some paperwork. But the feedback from our operations staff was like, no, we're the only financial institution in the area. We're the only one giving services. If there are one or two banks where we serve, the banks are closed down, we need to stay open. Our clients are relying on being able to have access to the financial services that we serve. So we've been operating business as usual.
Excellent, thank you. And one more question about banking services. Alex is asking how remittances have been impacted, both from the country as a whole and for those processed by SFF. And how is that playing out across Haiti and within SFF?
Actually, Mabel, back in March, when this pandemic started, it was a real concern for us here at SFF. As you know, the remittances is a big part of our economy here in Haiti. A lot of not just our clients, the population itself depends on those transfers they receive from the diaspora. But what we've seen in the activities, and even looking at our Fonkoze numbers, there has not been a real slowdown at all. We've kept pace to what we did last year. Even the average amount for the transfers went up. Last year at this time, we were at about 150. This year we're at 160. It doesn't seem like a big, huge increase, but it's significant enough to see that we have not seen a decrease in the number of remittances that we have received. We thought maybe the main numbers was because of the stimulus packages that we're giving out. But as we looking in June, the trend has still been steady. So far here at Fonkoze, we have not seen a decrease.
That's actually really great news, I think, to some degree, because it means that
yes,
people are still able to provide for their family and their friends. And obviously, since the banks are continuing to be open, that's great. And hopefully, you know, the trend will continue and that you will not see a huge drop in remittances. Corinne, I actually have a couple of questions for you. One of them is from Diana, who is asking, where does Haiti have ICUs and vents? And I know that this is a big question for a lot of people, because in the United States, we saw our hospital systems really be kind of overrun in certain cities when people have gotten really sick. Can you talk a little bit about what that health situation in Haiti looks like at the moment?
Yeah, you know, it's anybody's guess how many actual functional ICU beds Haiti has. There's been talk at the beginning of the crisis around March or so that there were only 20. And I'm talking not just of the beds and the ventilators, but you have to have the staff who knows how to work with it. You have to have hospitals that have regular electricity supply. You have to have all the other supplies you need to have these machines function. So at that time it was 20. I don't know where they're at right now. I know there are several initiatives that are actually looking at increasing the capacity to provide care to more serious COVID cases. But in general, honestly, and that is not just here in Haiti, it's also in Africa and some Asian countries, the fast line defense of actually providing people with oxygen through concentrators or through the tanks is almost more important than the ventilators. Because once a person actually needs a ventilator, the death rates are very, very high. And that's not just here, that's everywhere. So the level 1, providing people with oxygen and basic supervisions are really, really important. And there's quite a bit of work that is being done to make sure that that type of wards is available in all the main cities of the country. Partners in Health, Doctors Without Borders, several nonprofit organizations are also contributing to that effort. Now, what we're hearing for now, we're not hearing about hospitals complaining that they're getting overwhelmed. However, they are complaining that people are coming to the hospitals too late because they're afraid. And so they wait too long. And so once they actually get to the hospital, quite a few of them can't be saved. So the Ministry of Health has been sending out messages asking people, please, 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 as soon as you have trouble breathing, go to the nearest hospital or call the Ministry of Health.
Thank you. And so as a follow-up to that, Debbie asked, our Boutique Santé program is quite broad in its reach in Haiti. And so what is the role of the CHES in responding to COVID-19? And a little bit more on that is obviously, you know, their efforts in the community are not just focused on our clients, but as the community, the larger community itself. Is that correct?
Yes. Boutique Santé is really the basic infrastructure. It's Boutique Santé and it's the credit agents. You know, within, like I was saying in the interview, it's from the very beginning, we started training all the credit agents and all the CHES so that they would be able to train everybody else in their communities and the other clients. We've reached probably between 5,000 and 10,000 people since the beginning of this crisis, with just basic information about what COVID is, how do you protect yourself, and how do you recognize when there's a problem and you have to go to the hospital? How do you take care of yourself when you don't go to the hospital, when you have a mild case? So the CHES are really, together with the credit agents, they're the fundamentals of our infrastructure to get that message out. Now, on top of that, Boutique Santé has been able to work with local producers to actually get essential products for COVID prevention out in the communities. We've distributed tens of thousands of masks, the cloth masks that are actually produced here in Haiti. We've also distributed hand sanitizers produced in Haiti. It's actually quite funny. The hand sanitizers in Haiti, the ones we use in the office also, are based, partially the alcohol they use is alcohol that comes from sugarcane. It's actually undistilled rum. And so it has a really nice smell. Sometimes when they clean the whole office, you feel like, whoops, we're all going to go drunk in here. but it's really effective, and it helps the local economy because it helps also local entrepreneurs find revenues in these really difficult economic times. So it's essentially 3 products related to COVID that we are distributing. It's the cloth mask, it's the hand sanitizers, and it's these plastic buckets with a spigot that people use to organize hand washing stations in their homes.
Thank you. That's extremely helpful and adds. I can just actually smell like the rum, and it makes me very homesick for Haiti. Mary Claire, I have a question here that was sent in actually earlier today from someone who wasn't able to participate. What is the bank doing for individuals who may not be able to meet their loan obligations during this time, if anything?
As we always do, Mabel, we work with our clients on a case-by-case basis. So a lot of the time, I think there was a circular that came out from the central bank that a lot of clients did not fully understand. From what they understood is that they didn't have to pay their loans for 3 months, they didn't have to pay anything. What it actually said was you didn't have to pay on the principal, but you had to pay on the interest. So what it would have done is that they would have to pay more on the loan and push it a lot longer. But what we've been doing is working with individual clients to really see what their situations are. And we've been extending what we call rescheduling those loans and extending them based on the requests we have. And also we've been giving the moratoire. What's the English word for moratoire, Karine?
Oh God, I don't know. It's kind of a pause in repaying your loan.
It kind of pause on the payment, but you still have to pay the interest rate on it. So with so far we only had 73 clients that requested that, and mostly from our BD client, the larger loans that we had, and we've granted it. And as far as our solidarity clients, we have not seen much of a request. Only certain hard-hit areas by the border, because the border have been closed, where they've asked extensions, and a lot of them chose not to renew this month, and maybe next month when activities resume. We've had clients who were already approved for a loan, and at the end of March, and by mid-April came back and said, look, they can't take the money because they can't find merchandise. So we took the loan back without penalizing them and tell them, when you are ready, you approve, the money's here waiting for you to come back. And slowly we see several of them have returned to take out their loans and to resume activity. Fonkoze have always been flexible. We don't have a one-size-fits-all policy that we apply. We close to our clients. We want to hear what their needs are. We want to hear how we can help. And based on that, we customize the assistance we can give them. That's what we do. But so far, we've been working here. Not many requests.
That's really good to hear. So actually, I wanted to just circle back. We have about 15 minutes left, but I know that some people might have joined a little later. And so I wanted to ask each of you if you could explain from SFF and from the foundation the role of each of your organizations in Haiti, and how Fonkoze as a family differs from other organizations that are raising funds for Haiti, and especially right now during this particular crisis, because as we know, Haiti has had several crises, but in this case, in this moment, how are we different than maybe other organizations that are continuing to work in Haiti? Either one of you is fine.
You can start, Karen.
Okay. I think the main thing is that we're not a relief organization. So our job is not to find victims of a disaster or a crisis and give them a handout or a way to overcome that crisis. That type of service is necessary, but it's not what we do. What we do is we have a relationship with our clients. And when you have a relationship with someone and that person has a problem, you kind of help them however you can and whenever you can. but specifically herself and maybe her surrounding community. But it's that relationship we have, that ongoing partner relationship we have between the SFF clients, the members of the foundation, and Fonkoze. I think that makes us different. The second thing would be that in general, what we try to do, even if we help out immediately, we try and put it into some kind of a package of activities that will also have sustainable results. It's not, for example, when we train and when we inform people, it's not just about, okay, training and informing about COVID now. The whole issue about hand washing and hand washing stations is also very, very useful to prevent a whole heap of other diseases. You know, it is very important for hygiene in general. When we do CLM, it's not just supporting them now, giving them assets and giving them cash so they can survive on a day-to-day basis. Now it's building their capacity so that they can actually stand on their own feet further down the line. Up to you, Michael.
I'm here as SFF, as you know, with the microfinance, with the financial side. I have to say, any fundraiser during this COVID-19 crisis have been directly used for preventive measures for our client, meaning maybe the purchase of masks, hand sanitizers, the buckets that we've given out, even to some of our employees who are, most of our employees are not, or maybe 1 or 2 steps above our client. So they need as much as assistance as well for us to do. So any of the fundraising efforts during COVID-19 have gone directly to that. As a microfinance institution, and part of our mission and purpose is not to give help, like Karen said, just hand out, but how can we empower you? How can we assist you for you to achieve the goals you have set for yourselves? So I remember during Matthew where some of our clients lost everything. The best way to help them was not to wipe out the loan, but to top up, meaning to give them another loan on top to be able to get merchandise and be able to repay and to be able to resume the activities. So this is how we step in. We don't give hands out, but we do empower them to help themselves and how we can assist. And for this particular crisis, our assistance is really education, community outreach, and providing them with the necessities they need for prevention measures. And also, as a microfinance, how can we assist you? A lot of our team actually switched. If they used to sell cosmetics and did not have access to it, but now everybody required a mask, a lot of them switched to selling masks. They're adapting. And as they're adapting, we're here to support them to be able to adapt to whatever activity they decided this is what they need to do to get over the crisis, and we're here to support. That's what we do as an organization.
That's really great. Thank you both for that very good summary. And I think it helps, I hope, those of you that are listening and watching to understand better Fonkoze's focus and purpose, even during this pandemic. I'm going to take 2 more questions because I think we only have about 10 minutes left. Kathy asked about CLM, Corinne. Can you talk about a bit more about what CLM is looking like right now? And also just for some context, give the locations that we are working in Haiti and how many groups are supported, just a little bit of that, please.
Okay. So CLM is our program for what we call the ultra poor women in rural areas. Those are women who are isolated from their communities, who have children, and generally these families don't eat every day. They live in shacks, and essentially these are people who have lost hope and who live from one day to another. So we've learned from BRAC how to actually work with these people through a kind of coherent package of activities that enables them to develop economic activities, mostly livestock rearing and agriculture and a bit of small commerce. And especially they learn how to manage their assets, how to save and manage their funds, and how to connect with their communities. They really become connected to their communities again and take back control of their lives, really. So in these times of COVID, you know, it's really COVID on top of the troubles we had last year, on top of a drought that has been plaguing Haiti for the past year. So the economy is really, really difficult. And that means that quite a few families who were like just scraping by are actually falling into this type of ultra poverty. And that is why we keep saying that CLM and that kind of support program is more than ever necessary. We're recruiting a new group of 1,000 new families in the Southeast with support from the Swiss government. And we have already around 600 families in the program. But the more we can extend the program, the more families it's going to help. The other thing we're doing is we're actually piggybacking on the selection process of CLM. CLM really goes and finds the very poorest of the poor in the communities. And what we do is, while we're doing that, we're also looking at families who are not quite at the level of poverty that CLM is, but who still need help. And we're looking for funding to help these families through a few cash grants, but also a training program so that they can set up village lending and saving associations that will help them, for them to learn how to better manage the cash grants they have and get a sustainable kind of improvement of their economic situation out of that. I hope that answered your question, Mabel.
Yes, thank you. And then Mary Claire, I have a question for you. You know, in the US, the effects of COVID on the economy were pretty obvious. We had people stay home, people stopped eating out, no one was going to bars, no one was going to the gym. It was basically, you know, we talked about a complete shutdown. And then eventually some restaurants have gone out of business, other, you know, never, even retail stores are not returning. So how does COVID in Haiti impact that solo entrepreneur who lives in a rural part of the country that who may do, I don't know, basket weaving or grow and sell crops? Like, what is the approach during this time?
I have to say, the crisis a lot of those solo entrepreneurs have been going through did not start with COVID. I can say it started since last summer, maybe, or even a little before that, with our political crisis that we're going through. What happened is, with a lot of these people, the roads were blocked. They couldn't bring, if it was somebody in agriculture, they couldn't bring their goods to the marketplace and back and forth. So that was a challenge. Now with COVID, what we realize is, and what I stated earlier is, a lot of them are having a hard time, and a lot of them have taken the opportunity to switch. I used to do basket weaving. I'm gonna put it on hold, and now I'm gonna make masks. I used to sell cosmetic. Now I'm gonna sell any other preventive medicines that's out there over the counter. So what we've realized is they have been very flexible, as always, resilient as always, to be able to switch. But a lot of them are being impacted as well, where we see that, and as Karen mentioned, in the far rural areas, there's another reality that's happening, is famine, the hunger, food insecurity that we're worried about. So that has had an impact as well for us, and we're looking at it. It's a struggle. It's a real struggle, and we're trying to find ways to adapt and adjust what we do to be able to meet some of those needs. And I know with the foundation, we had several discussions about the food security and how one report says that we're more food secure, but then when we look at the overall and overall in the country and certain areas we work in, the food security has gotten worse. So we are trying to adapt and cope and know that's the new reality and recruit some of those clients as well. So it's like CLM is looking for some of those. Now we recruiting them in solidarity and see what little activities that they have. If they were not clients before, how can we boost the little activity that they have and help them to push along? But it's becoming a challenge.
Yeah, I can imagine. And so hats off to you both, your teams, for the amount of work and dedication that you continue to give to Fonkoze. I know that there are clients that are in desperate situations, and I also know that some of our staff are also face very similar situations, and so the dedication that they have to the mission of Fonkoze and to being able to lift up other Haitians is really, really important. And so hats off to all of our colleagues in Haiti, and to both of you. Thank you so much for your time today. I hope that it has been, to those of you watching and listening, it has been informative. Fonkoze really tries to walk that line where we provide information that is critical, but we don't like to be overly scary, but rather be very factual, because our colleagues work really hard to continue to provide services to our clients, and I want them to get all of the credit for all the great work that they have been doing. And so this evening, as I close, what I would like to ask you, if you're listening and you feel moved to make a contribution to Fonkoze, is to know that you will be making a contribution today, potentially, to the response for COVID-19. But Fonkoze is going to be here to see COVID-19 through, and to, as my colleagues say, be able to help solo entrepreneurs, women entrepreneurs, micro entrepreneurs adapt, respond to the needs of their everyday reality. We are not here for just this moment, just a flash in the pan. We have been here for 26 years, and we will stand in solidarity, shoulder to shoulder, with our clients, our friends, and our family in Haiti for as long as they need us and they continue to depend on us. So please, if you are interested in supporting this initiative today, I urge you to go to fonkoze.org. The link is also in the chat box, and make your contribution. Please remember that the board of Fonkoze USA is matching dollar for dollar tonight up to $25,000. Thank you so much for your time, your support, your advocacy, and your love. We hope to talk to you again soon. Thank you, and in the meantime, stay well. Bye-bye.
Thank you. Bye-bye.